Hi, I'm going to perform an arthrosamid injection into this patient. So I put my probe on the knee, and on the ultrasound screen, you will see she has got lots of fluid in her knee joint because of the inflammation of the joint lining, which we call synovium. So the normal function of synovium is to produce this joint fluid to lubricate the joint, but when it gets inflamed, we start to produce lots of fluid, which you will see in a minute. So we are going to aspirate this extra amount of fluid to give her some more relief of pain. And once we have done that, then we'll put the oxysment inside the joint capsules. So on the screen, you can see this lady has got lots of fluid in her knee joint in the suprapatellar pouch. This excessive fluid is formed by the inflamed synovium, which also causes stiffness of the knee joint. So I'm going to aspirate this excessive amount of synovial fluid under the local anesthetic so that she feels more comfortable before I inject Arthrosamid injection. So on the screen, you can see that my needle has approached the suprapatellar pouch, and I'm injecting local anesthetic into suprapatellar pouch, so that when I'm aspirating the synovial fluid, this patient doesn't feel any pain. So you can see that I have taken about 60 ml of synovial fluid from the suprapatellar pouch of this patient's knee joint, which will give her lots of comfort on top of Arthrosamid injections. So now you can look at the screen and see that we have taken almost all the fluid from the suprapatellar pouch. It's looking nice and dry, and this is the time to inject the Arthrosamid injection into her knee joint. Now this is the time to inject Arthrosamid. I'm injecting Arthrosamid. It's flowing very nicely into the suprapatellar pouch. You can look at the screen that my needle is in suprapatellar pouch and I'm injecting Arthrosamid injection. It's flowing very nicely and dropping beautifully into the suprapatellar pouch. The placement of this injection is utmost important that we inject it in the right place. So I have aspirated about 60 mils of synovial fluid from the suprapatellar pouch and then placed the Arthrosamid very nicely, and patient very comfortable. Thank you.